For many years, mammography has been the standard screening test for breast cancer. Improvements in imaging have helped in detecting cancer earlier, saving many lives. Now, a new technology called tomosynthesis is being tested at Hoag Memorial Hospital Presbyterian in Newport Beach. Dr. Gary Levine discusses this 3D digital mammography.
For the past 40 years or so, mammography has been the gold standard for breast imaging. But the quality of the mammography has really changed over the years to the point where most recently, over the past 5 years, it's been a real quantum leap from standard film screen mammography to now what we call direct-to-digital mammography. It uses the same X-ray source as a traditional film screen mammogram, but instead of displaying the image on film, the information is captured digitally and displayed on a computer screen. And it's really shown to create a much higher resolution, much higher quality mammogram. And studies have shown that, at least in certain subsets of women, it's better able to detect cancer at an earlier stage. Three-dimensional mammography is a term used for the formal name digital tomosynthesis, which is the next generation of mammography.
We asked Dr. Levine, what are the advantages of this new imaging system?
The real limitation of mammography is that it's a two-dimensional representation of a three-dimensional structure. And because of that, when we look at an image on a mammogram, the breast tissue is often superimposed. And that superimposition of normal breast tissue can mask a cancer. What digital tomosynthesis is doing is it's a three-dimensional mammography. So it's similar to a CAT scan of the breast in that it's created by an arc of an X-ray tube over the breast, taking images at multiple different angles. Those images are put together by a computer into a 3D rendering of the breast. And because of that three-dimensional capability, we're able to separate out the different elements of the breast and be able to identify a tumor that might otherwise be masked by surrounding breast tissue. There's a lot of information on the mammogram, extraneous information that has to be filtered through to find the pearl, which is the early breast cancer. Because we know that if we diagnose breast cancer early, we can cure it very simply. 3D mammography is going to be a similar situation where we have to be educated and have experience in how to interpret these studies. And it'll be a little bit different type of study because there's so many slices through the breast rather than just two images of each breast as we've traditionally seen. So it's the only site in Southern California and one of 11 sites in the country that will be studying this. And we'll be studying high-risk patients, women who are at elevated risk for breast cancer for various reasons. And we'll be doing a standard two-view mammogram digitally versus a 3D mammogram that we do with this digital tomosynthesis. And we're comparing the ability of the two technologies to detect breast cancer early. The goal of any new technology is to be able to diagnose the breast cancer early. And we certainly think that digital tomosynthesis will allow us to diagnose breast cancers earlier. And it'll be the job of the radiologist to be able to work out the best manner in reviewing these images so that we can identify the cancers. Anybody that presents at Hoag Breast Care Center for standard breast imaging, mammography will be evaluated, and if appropriate risk factors are found, then they will be offered inclusion into the trial.